Hi everyone, welcome back to The Colorectal Surgeon. I am Dr. Samrat Jankar, the board certified colorectal surgeon and fistula expert. You know that in fistula, a diagnosis is important. Today, in this video, we are going to discuss about how fistula is diagnosed. We will going to discuss about modality of investigation available for evaluation of the fistula, starting from simple X-ray fistulogram to a most advanced and gold standard investigation MR fistulogram. If you or your loved one is suffering from the fistula or fistula like symptom, diagnosing a fistula prior to any kind of treatment is most important. For that, this video will be a more helpful and it will give a lot of insight about the fistula treatment and diagnosing modalities. Let's deep dive into the video. Before landing into the diagnosing of fistula, let's brush up what's the fistula in ano. Fistula in ano is nothing but a abnormal tunnel connecting inside the anal to the outside skin and having a recurrent pus discharge, pain and swelling as a symptom, and it is one of the frustrating chronic problem and most important risk after doing treatment is recurrence. For diagnosing of the fistula, most important thing is the clinical history and examination by any colorectal surgeon who is expert in fistula treatment. Uh, any patient who is having the fistula usually presenting with a persistent perianal pus discharge, which is a key presentation of any kind of fistula associated with perianal itching, perianal swelling, perianal pain, perianal discomfort. Usually, a person before developing fistula will have some infection of anal gland. Usually, there are 8 to 12 located in the anal canal. From there, infection travels across the sphincter and into the perianal spaces where it forms the abscess. The abscess may spontaneously burst open and discharges the pus, or sometimes we need to meet the surgeon and drain surgically, followed by within 2 3 weeks the wound start healing, but at the end of the 3 or 4 weeks there will be a persistent pus is coming, wound is not healing. That is the time fistula has been formed. Classical presentation of fistula is the period of normalcy where you will have some amount of dimple or hole in the perineum, that is external opening, followed by there will be a sudden onset of perianal pain, perianal throbbing kind of discomfort or painful condition. That's a swelling pus has formed. Suddenly that pus will empty out from the external opening. You will feel that pus has been discharged and again you will be in normalcy. And that cycle goes on recurring week to week or month to month. That's a classical presentation of any kind of fistula. If you are suspecting the fistula, that time the clinician or colorectal surgeon will do rectal examination along with proctoscopy or anoscopy to find out internal opening, the extent of the tract, where is external opening, or any kind of palpable tract is there, or any associated with other kind of problems. The surgeon can examine you in the lateral position or jackknife position to see what is the extent of fistula and also diagnose what type of fistula. If you are suspecting it with fistula nano, it has to be confirmed with better radiological modality like X-ray fistulogram, transrectal ultrasound, or with MR fistulogram, so that we can offer best possible treatment, that can be sphincter putting or sphincter function preserving surgery. Along with that, we can reduce the risk of recurrence and also the dreaded complication of fistula, that's risk of incontinence, can be nullified. MR fistulogram is the gold standard investigation modality available at present to evaluate any kind of fistula. MR fistulogram is most important to know the extent of the fistula, complexity of the fistula, origin of the fistula, and also it can be a roadmap for a surgeon to plan better modality of the surgical treatment for your particular case. MR fistulogram usually helpful to confirm the diagnosis of the fistula or abscess in small doubtful cases. MR fistulogram can give us a internal opening exactly where it is located, which is very crucial in case of any kind of fistula to get the better success to avoid the recurrence. MR fistulogram can map out any kind of secondary extension. If we missed on table while doing surgery, there is high likely that it can recur, which can be avoided by better MR imaging. MR fistulogram can give us a sphincter involvement that's very crucial to decide kind of surgery which will helpful avoid the incontinence. MR fistulogram can give more detailed information about the perianal spaces, involvement, and anywhere it is going, so that possibility of recurrence can be reduced, possibility of incontinence can be reduced. If you are going to any colorectal surgeon who is an expert in fistula treatment, you need to carry a MR fistulogram CD of MR fistulogram or better quality images rather than the report, which will be helpful for the surgeon to read, understand. Usually we prefer with contrast in most of the cases, and preferentially you should get done the MRI in the center where there is a high quality MRI, at least 1.5 Tesla or more the intensity of MR film, with good radiologist and expert technician and expert radiologist to read the MRI report, so that the quality of MRI report will not be compromised and we will get the better mapping for the surgeon to plan his surgery in better outcome basis. Ultrasound also one of the modality available for diagnosing the fistula and ano, but ultrasound, although it is cheaper, which is widely available and it can be easily done, but there is issue with ultrasound is it is operator dependent. Reports are better in skilled radiologist hand. Usually the images are not transferable and not possible to read by the surgeon. In contrast, MRI can be done at with a proper radiological setup. With proper quality machine, we can get a adequately good result and reports. The images and CD are readable by the surgeon. Most important, if we have done the MRI and there is a 2-3 weeks gap before the surgery, if surgeon want to read the images and reconfirm, map out your fistula on table, MRI will come in handy. So usually in our setup, we prefer MRI more than truss, but in truss or UAG. But in UAG also, the perineal UAG, perineal scan or transrectal scan are available. If combined both can give better result. Either one if we do, it has its own lacuna and limitations. X-ray fistulogram is one of the very famous modality for diagnosing the fistula in olden days, where dye used to be injected into the external opening to map out where dye is reaching and where it is connecting to anal canal. The most of the time this modality usually miss the secondary track, usually not able to diagnose the internal opening. If there is a blocked track, it has its own limitation. If there is a secondary extension, it cannot be read on the X-ray fistulogram, or exact sphincter involvement cannot be noted on MR fistulogram, on X-ray fistulogram. So in presence of modern days modality like MR fistulogram, the X-ray fistulogram is an absolute modality. Nowadays, no surgeon or colorectal surgeon does X-ray fistulogram for diagnosing the fistula in ano. Almost very rare remote places X-ray fistulogram is done. Nowadays preferred modality is X-ray fistulogram at most of the center, in our center, and few of the center perform the surgical procedure based on UAG, based on transrectal or transperineal ultrasound. At the end of the video, to summarize about the diagnosing fistula and ano, although clinical examination, clinical history is most essential part in diagnosing the fistula, but in current era, having the modern investigation like MR fistulogram, ultrasound are crucial for guiding us to give a better outcome and a lesser complication. And most important, getting MR fistulogram is one of the modality which can guide any surgeon to map out the fistula to give better result, lesser recurrence, and least possible risk of incontinence. If you or your loved one is suffering from any symptom of fistula and ano, such as perianal pus discharge, discomfort, itching, pain, it's better consult your nearby colorectal surgeon, qualified colorectal surgeon, for proper diagnosing, along with having a modern days imaging modality so that we can map out a fistula and we can provide the better possible treatment modality or sphincter cutting or sphincter function preserving surgery to give you optimal result with least complication. If you like this video, don't forget to like, subscribe, and share our channel for more and more video related with colorectal health. Till that, take care. Bye bye. Thank you for watching.